CDPH does and is doing, and for all the partners who have participated and will continue to participate in the Healthy Chicago work. We have deeply entrenched inequities in this city, as you well know, right? And we have to tackle them head on. And that's what the work of Healthy Chicago has been doing. You've been calling out what needs to be called out. And you've been saying we're not going to get to a better, stronger, safer, and healthier Chicago if we don't tackle the social determinants of health. So just thank you for seeing that vision, for doing that work, for bringing all the partners to the table and collaborating so that we can continue to chip away and fully eradicate, right, all of these systemic inequities that particularly harm our Black and brown communities in Chicago. So thank you. I hope that today is fulfilling, is giving you the vision and the energy and the renewed sense of community to continue to move this work forward. Thank you so very much. Have a great one.
Good morning, good morning. Okay, I know it is early and this is a formal event, but can I get a better good morning, y'all? See, that's why I love Chicago. Good morning, my name is John Jones. I will be your MC today for our Healthy Chicago 2025 Symposium / HCEZ Showcase. I see some familiar faces, I see some brand new faces, but it is good to be here with you all today. First, I wanted to go over some groundkeeping rules. One, the bathroom. The bathroom is when you walk through the entrance, walking in, you're gonna take a left. From this way, you're gonna take a right. There, you'll see your public restrooms, and then you'll be good to go. We are now gonna go over the agenda. So I believe you have a copy. If not, you can look at the screen. Today, our agenda consists of a few components. Starting off, we will hear from Megan Cunningham and Jenny Turter with the Welcome and the Healthy Chicago 2025 overview and update. Then we will hear from our 6 regional leads and some community leads as well in our Healthy Chicago Equity Zones initiative via a panel. Then we will transition into networking, also partner tabling as well. Please, if you look over to your left, you'll see a multitude of tables as well as some in the room prior to entering this venue. So please check those out as well. We will proceed to lunch, and then we'll have breakout sessions after lunch, and then we will close out around 2 o'clock. That sound good, everyone? Perfect, perfect. Well, before we get started, we want to provide a land and labor acknowledgement. So I will be introducing to the stage Brittany Williams.
Adjust for the height. Good morning, everybody. It's an honor to stand in front of you today. I just want to read these prepared statements. So, on behalf of the Chicago Department of Public Health, we acknowledge that the city of Chicago is built on ancestral lands, embracing skies and water that have been the center of the native peoples. We benefit from the traditional lands and unceded territory of the Council of the Three Fires, the Ottawa, the Ojibwe, and the Potawatomi nations, the Illinois Confederacy, the Peoria, the Kaskaskia nations. In addition, other nations that call this land home include the Miami, the Ho-Chunk, the Menominee, Fox, and Sac, who have served this land. We honor their survival through colonization and forced assimilation and their resiliency while fighting oppression. These nations continue to honor and maintain their heritage and beliefs, and we, as a city, are indebted to these Native communities. We also acknowledge the labor upon which our country and its institutions are built. We recognize that our country was created on the labor of enslaved people who were taken from the African continent. We acknowledge that this country's structures would be obsolete without the free enslaved labor from individuals of the African diaspora. We also recognize the contribution to building this country by way of all the immigrant labor, including voluntary, involuntary, trafficked, and undocumented individuals. To honor this space, we must admit our country's historical truths and acknowledge our mark on the space in which we gather today. It is our collective responsibility to critically interrogate these histories, to repair harm, and to honor and protect and sustain this land. As we acknowledge the historical land and labor injustices that have shaped our present, we also recognize the responsibility to actively contribute to healing injustice. The Chicago Department of Public Health's mission is to work with communities and partners to create an equitable, safe, resilient, and healthy Chicago. Today, we encourage everyone to commit to support this call to action. As Chicagoans on this land, we should feel obligated to acknowledge the lasting impact of colonization and racism on Black, Indigenous, and other people of color. Everyone should look for actionable steps that will honor the Native peoples on whose land we live and work, and those whose forced labor provided the opportunities we experience today. Through collaborative efforts, we can build an equitable access to health care, address health inequities, and amplify marginalized voices. By recognizing the intertwined legacies of labor, land, and health, we encourage engagement in ongoing education, partnership building, and advocacy to create a more just and inclusive future for all. Thank you very much.
Thank you, Brittany. Also, I recognize that I did not acknowledge Brittany Williams is new to CDPH. She's our new Chief of Racial Equity Officer, so please give a warm welcome to Brittany Williams. I do apologize. I do apologize. So now we will transition to hearing our keynote. We will hear from Megan Cunningham and Jenny Turner. So ladies, whenever you are ready, please join the stage.
Oh, good morning, everyone. It does my heart so much good to be here with all of you today and to share the stage with the incredible Jenny Turner, who is the heart of the Healthy Chicago 2025 movement. Okay, y'all, we're gonna have some fun together today. And I am really excited to have the opportunity to welcome all of you as we reconnect and as we recommit to the foundation of Healthy Chicago 2025, which is to close the racial life expectancy gap in the city of Chicago. So next slide, please. So here's just a little bit of a preview of coming attractions. Today, we are going to share the story of the Healthy Chicago movement, because this is a fast-moving train, and some of you have been with us for decades, and some of you are just getting to know us now. So we want to root all of us in that story of Healthy Chicago. And we want to welcome people like Deputy Mayor Jen Johnson, who are now also incredible champions of this movement. And then we'll spend some time looking at the data, because it wouldn't be a public health symposium if we didn't talk about a bit of data. So we will review what we know today about the gaps that persist in the city of Chicago and of the gains that we have been making over the last few years because of all of your work since we launched Healthy Chicago 2025. And then we're going to celebrate you, because this work is hard and it takes moments of pause and reflection for us to really lift each other up in this work and talk about the so very many things that are moving in the right direction in the city of Chicago because of our collective commitment to public health. And then we are going to link arms, join hands again as we think about the 2 years that remain under the Healthy Chicago plan, as we think about our investments in the future of this city to a generation where we don't have these sort of deep entrenched disparities between our Black and brown communities and our white communities in the city. So that's what's on tap. And I'm going to start by just kicking us off with the story of Healthy Chicago. What you are about to see is a beautiful collection of slides that I had very little hand in making. And so I want to just take a moment and acknowledge our friends and colleagues from Big Mouth who are here. Shout out to Big Mouth. And I'm going to be doing this in probably kind of an annoying way throughout. I'm going to ask people to like self-identify, self-celebrate. When we are calling out your work, when we are acknowledging you, we want to do it for real, for real. So please be bold and brave and own your successes as we go, and don't let us embarrass you too much. All right, so here's a little bit of the story of Healthy Chicago. There's a specific pride in being a Chicagoan. It's in the way that we walk our streets, the way that we come together to celebrate, and the way that we care for our people. In Chicago, our communities reflect our pride. And now I can't read what it says on the slide, so I'm going to have to go to my slide. Pardon me as I catch up. Each community is unique, but they share a common goal: access to the resources and power to lead healthy lives. But too often, Chicagoans have limited access to resources and their voices are undervalued. Our Black communities are especially impacted by these disparities, and as a result, their lifespans are shorter. And that's where Healthy Chicago comes in. We started as an idea, we evolved into a movement, and now we are taking action. Together, we are creating the communities that we deserve. So if you are here today because you represent a health system delivering direct healthcare services, can you give yourself a big round of applause? If you are here today because you represent a foundation that is offering resources to this movement, can you give yourself a round of applause? If you are part of an academic institution that is doing critical research to help draw attention to these disparities and address them, can you give yourselves a round of applause? If you are here today because you work for the City of Chicago government and you are doing this directly in your capacity as someone who is not just a resident but a city worker, can you give yourself a round of applause? And if you are here today because you are a frontline community organization who deeply loves your neighborhood, give yourself a round of applause. And now I'm going to turn it over to Jenny.
Okay, so as Megan was saying, we started with an idea, and that idea gave birth to Healthy Chicago 2.0. It was our first improvement plan, public health improvement plan, that really centered on the social determinants of health. Next. As we went into COVID-19, we had planned to release Healthy Chicago 2025 around the same time that the first few cases were starting to show up. And we took a pause because we were seeing the impact of COVID, the disproportionate impact of COVID, and the quest for more intentional race equity initiatives. So with this exposure to these longstanding racial inequities and the pandemic really required, again, intentionality in how we were partnering with communities. It wasn't the first time we partnered with communities, but really the communities was where the knowledge was to help us get through. Next. So with that, we reformatted Healthy Chicago 2025 to center on those social determinants of health, but then intentionally calling out institutional racism as a root cause of the inequities that we see, that we experience day after day. Next, thank you. So in Healthy Chicago 2025, the vision, which you guys can see up there, really just talks about the fact that everybody, every community, should have equal opportunities to live an optimal health and well-being. That means that you have equal access to resources, environments, and opportunities. And so the mission, as Megan stated when she first came up, to close that racial life expectancy gap. In order to do that, we have to focus on improvements for the people that are most affected by inequity. So that's improvements in systems of care, furthering healthy neighborhoods, strengthening the community capacity to do the things themselves. So giving the resources, giving the ownership to the community to make the changes. And being, again, very specific about our policies and processes and just asking the hard questions. Are they anti-racist? Are we building multicultural systems? So, who is part of Healthy Chicago? Everybody in the room, please just do this. That's right. You, everybody watching on live stream, hope you raise your hand wherever you are, because you too are part of Healthy Chicago. So together, all of the cross-sectored, cross-systems people who are working to promote that health and racial equity, to coordinated action, you know, not just being willy-nilly and doing things, being intentional again, and we're bringing the people together from all across the city, neighborhoods, faith-based, business, government, policies. There's nothing that you can say that you do or not do for a living that does not make you part of Healthy Chicago. If you're breathing, you're here in the city, you're part of Healthy Chicago. Next. And what makes this approach a little different than what we've done before? Again, we have these guiding principles that we focus on in a document about this is our North Star of what we should be looking for when we're making, when we're making our changes to the system. Asking the question, are we being anti-racist? Are we focusing on not just deficiencies, but the assets that are out there? Are we doing capital building for individuals and communities? Are we ensuring that we are community-led? If you have worked with me, you know I've said that word probably 100 times a week. Are we doing community-led efforts? And are we equity-focused, and are we trauma-informed? The next slides talk a little bit more about the guiding principles and the questions that can be asked as you're looking at the work that you're doing in your systems, in your organizations, in your departments, of what does this really mean. And these slides will be available to everyone, and you can use them to focus on the work that you're doing and ask things, how can we ensure that communities have access to funding and build wealth? I know my community partners that I work with day to day want to know about the funding. Is that not right, community partners? Number one question I get, what opportunities can we create in our communities? What opportunities are we creating for community storytelling? Next. Again, that community-led, my community partners know that they want to know that they can make decisions themselves about how the resources are used in their community. How are we building, support for acceptance and fairness? And how can we do our work and avoid bringing up existing traumas? So where are we focusing our efforts? This is still me?
Yeah.
Okay. Up till 3, y'all. So here are all the areas where we're working. So if anybody in here has been supporting environment, breathing clean air and drinking clean water and everything that is environment, can you do a clap for me? Okay, thank you. Healthy food that's close to your home. Love it, love it. Creating vibrant neighborhoods that reflect Chicago identities. Love it. Public safety, violence prevention, equitable and accountable institutions. Housing, safe, affordable housing for who? For everyone. Right. That's the claps there. And access to health and human services, making sure everybody can take care, physical, mental, emotional needs. And of course, our public health system, making sure that safe public safety spaces serve all of Chicago. And that should be everybody, because everybody's part of the public health system. So one more big clap. So next, I will turn it over to Megan to talk about our gaps and our gains.
Okay, so this is going to be your little data sampler for today, and if you are interested in digging deeper into the data that supports and powers the Healthy Chicago movement, I encourage you to join the data breakout session that our Office of Epidemiology will be hosting this afternoon. So here's the teaser. We're going to start where we always do with Healthy Chicago, with a focus on the racial life expectancy gap in the city. When we launched Healthy Chicago back in 2020, we looked at data that was current as of 2017. And at that time, the life expectancy gap stood at 8.8 years between a Black Chicagoan and a white Chicagoan. And we understood that this was an unjust and an entirely preventable phenomenon. And so we have continued to really look at life expectancy as the key indicator of whether we are actually doing the work of transforming our policies, our systems, our institutions to move us as a city in the right direction with respect to health outcomes. So now we have data that is current as of 2020. So looking back, just still on the last slide. So looking back at what the last few years of life expectancy trend was for the city of Chicago, between 2017 at launch and 2020 with the most current available data, we've seen that life expectancy gap has actually grown to 10 years. And that's really before we experienced the peak of COVID. So we are in the process now of continuing to analyze our data so that it can be current through 2021, and we're re-examining data based on this most recent decennial census data. So, every 10 years as a country, we take a look at our demographic trends, and we know that there have been some significant demographic shifts in the city of Chicago between 2010 and 2020. So we're actually going back now and we're recalculating all of this based on what we know was true at the time from our census data. So very soon, we are going to be releasing updated information current through 2020 that takes that census shift into account. So what I want to preview for you today is a little bit of where we think that data may go. So we think we may start to see over into the next couple of years of this data, of course, the rebound from the COVID-19 peak. We expect, actually, from our demographic data that what we thought we knew about the Latinx community in the city of Chicago has actually, the picture has shifted somewhat. So the decennial census data is showing us that the Latinx population was actually somewhat older than we expected in the city of Chicago between 2010 and 2020. And so when we go back and we do that recalculation, we may actually see some shifting in what we thought was a significant decline in Latinx life expectancy, maybe somewhat tempered. And that also means that what we know about the needs of that community, if it is an older population than we expected, we need to think differently about what sort of resources and supports that population continues to need. And then we think that there is the potential to see an even still widening gap between Black Chicagoans and basically all other racial and ethnic groups in the city of Chicago. And so that's what I most want to convey today, is that this work is not done. This is all preliminary analysis. We will be coming back to you all with more information over the course of this fall. But we did want you all, as our local public health system partners, to know what we think we are starting to see in some of these trends. Next slide, please. So then, of course, we need to dig deep onto what is driving the gap so that we can be really intentional and evidence-based in what we are doing to try to close it. So 4.4 years of the life expectancy gap continues to be driven by chronic disease, an outsized share. And what we know about chronic disease is that it is so much a product of the conditions of place, right? If you don't have a grocery store down the block that sells affordable, healthy foods, it is very difficult to eat healthy. You may be more likely then to develop diabetes. If you don't have a safe park down the block where you feel like you can go play with your kids and be active and recreate, it may be really difficult to get that physical activity in. And then you may be more likely to see heart disease. So when we talk about chronic disease, what we are really talking about is how do we change those conditions of place? And that's why all of the work of the community partners here today and all of you who are working at these issues at a systems level is and will remain, even with this changing data picture, so deeply and critically important. And then the other drivers of the life expectancy gap, in this order, were gun-related homicide, infant mortality, HIV and infectious disease, including starting to see that contribution of COVID, and opioid overdose. So as we're analyzing this newer data and what you may see coming out later this fall, we think we may, of course, see that greater contribution of COVID to the gap. We think we may see, in line with some national trends, some improvement in infant mortality, which was actually a byproduct of some of these stay-at-home orders where the families were together and had an opportunity to be with children in their youngest months. But we know that chronic disease is going to remain the primary driver, and so we call upon all of you to continue to focus your efforts and your energies on what can we do in this space. We may also see an increased contribution of accidental deaths, and this is, we think, a product of some of just the social disarray that was happening in COVID. People's driving behaviors changed, people's personal behaviors changed, resulting in some of these greater accidental deaths. So more to come on all of that. But I don't want to just linger on gaps. I want to really focus today on gains, and on gains in some of the sort of unexpected places in particular, places in some cases where it's really been core public health and systems efforts that have resulted in us moving absolutely in the right direction. And so to talk about that today, we're going back to some of our Healthy Chicago 2.0 indicators, so our plan from back in 2016. And again, in the data breakout session, if you really want to wonk out about all of this, our EPI team is happy to do that with you. But just to run very quickly through some highlights, tobacco use in the city of Chicago has been on this incredible downward trajectory over the last 25 years with the Master Settlement Agreement. And we have seen since Healthy Chicago 2.0 a 9% decrease in tobacco use among youth and a 7% decrease among adults. So if you're doing work on tobacco control in the city of Chicago, anybody in the house from our college? Yeah. We celebrate you. We also look at this indicator of overall self-reported health. And this is a really important one because it actually gets to people's lived experience of how do I feel as a person out there in the world every day? Do I feel healthy? Do I feel well? And we have seen since Healthy Chicago 2.0 a 6% increase in overall self-reported health. So if you're feeling good today, give a little shout out. And then we've had some gains in access to care that are really important. So around just insurance coverage, since Healthy Chicago 2.0, we've seen a 10% increase in Chicagoans who have access to insurance. And we've seen an 11% increase in primary care access, which we know is so important to the prevention aspect of public health. And I just do want to say, in a moment where we are facing a Medicaid redetermination process and people who had just been guaranteed access to insurance are now losing it and needing to reapply, I want to call upon all of us to preserve and protect this gain, to do what you can to make sure that people know about how to get and stay enrolled in insurance coverage. So if you're doing work on anything related to Medicaid redetermination, insurance, enrollment, give a shout. And around youth suicide attempts, we've seen a 4% decrease. Around behavioral health hospitalizations, we've seen a 53, this one is a harder one to explain, but there are 53 fewer behavioral health hospitalizations per 100,000 people. So that's kind of a tricky number to make sense of. It's a public health wonky number, but it is a really important number that we are seeing markedly fewer behavioral health hospitalizations in the city of Chicago. And similarly for infant mortality, since Healthy Chicago 2.0, we've seen 4 fewer infant deaths per 1,000 people. So these are really remarkable achievements. These are testaments to your work. These are stories that are not often enough told. So we are really excited to share that with you today. And then finally, I want to encourage all of you to continue to be these incredible data ambassadors for Healthy Chicago 2025. I know that I am among my people who love and use the Chicago Health Atlas as your primary source of public health data. Many of you have become these real data scientists. And I just want to make sure that everybody knows one of our commitments when we launched Healthy Chicago 2025 was to build an equity data dashboard for the city of Chicago, because we believe that data is really important to be democratized among all of us so that we can use it in our advocacy in our respective areas. And data needs to be transparent so we can hold each other and our institutions accountable. And so with the Healthy Chicago 2025 and We Will Chicago Equity Dashboard, you can now go to one spot and you can look at key indicators of equity across all of these various pillars of economic development, of housing and neighborhood, of arts and culture. So I really do encourage everyone to visit chicagohealthatlas.org and to take a look at the equity dashboard. This is how we are continuing to make sure that we convey and communicate progress towards racial equity on some of these seminal indicators of racial equity. Okay, now I'm going to turn it over to Jenny. She's going to give you some more really specific examples of initiatives in action towards Healthy Chicago 2025 goals.
Thank you, Megan. I'm not sure who my timekeeper is, but can I get a time check from somebody? What time are we at? Thank you.
We're right on it, Jenny.
Hey.
We're nailing it.
I told you, we only have 2 hiccups to get to today, and that's it, no more. Okay, so addressing the life expectancy gap. So here are the areas where we have been putting some special focus. Chronic disease. So our great community health response course, and if you are here representing that, please. So that is over 100 community health workers across 10 CBOs, and they provide outreach services and referrals at 729 community events. So these are food pantries, pop-up clinics, CPR trainings, et cetera, et cetera. That program started in November of 2022, and they continue to do amazing work. So shout out to those with the Community Health Response Corps. Woohoo! Go ahead. Gun-related homicide. So we have, through the city, funded 18 street outreach organizations covering 25 communities. So this is prioritizing individuals at the highest risk of either being victims or perpetrators of violence. Fatal, non-fatal gunshot injuries decreased more than 30% in 24 months following participation. Yes, yes, yes. Let's continue that trend, everybody. Who is working on violence prevention? Big shout out to you again. Infant mortality. The Family Connects Chicago program has expanded availability of in-home nurse visits and supports to birthing persons, newborns, and their families. So I love hearing this as the official auntie in my family to all the little ones. 7 of Chicago's birthing hospitals, that covers 36% of all births in Chicago hospitals. Service will be offered in 11 hospitals by the end of this year, with the goal of all 15 hospitals by 2024. So Family Connects, doing the job. Thank you. Infectious diseases, new HIV diagnoses are at their lowest levels since the late 1980s, with fewer than 640 cases diagnosed in 2020 and 2021. And the viral suppression has increased from less than 50% in 2019 to 60% in 2021. So those who are working on HIV and infectious disease, thank you for the great work that you're doing as well. We hear a lot in the news about the opioid overdose and the crisis there. And so our immediate opioid treatment program, MAR Now, has connected over 700 people to medications to treat the opioid use disorder since just May of 2022. And the partnership with libraries have distributed, where's my library folks? Has distributed over 10,000 naloxone, did I say it right, y'all? Kits to the community since January of 2022. So thank you to the libraries, thank you to the people who are working on MAR Now and all of the opioid use programs. Finally, we have environmental justice. Love it, love it. So we issued the Environmental Justice Executive Order with first citywide cumulative impact assessment in progress. I hope that you guys have been following the news and going to the meetings on those. They have just been so amazing just to see this movement for environmental justice continue to grow in our city. So thank you all who are working on that. The launch of 211 Metro Chicago, again, an all-one source for health and human services happened. So that is our health and human services continuing to improve, getting the care that every Chicagoan needs and deserves. So those who are working on 211, healthcare access, thank you. And then a 2021 assessment for housing changed how it gives out housing subsidies, with a focus on both racial and geographic equity. So building equity into existing processes is what we are all about. Thank you, those who are working on housing. And the Crisis Assistance Response and Engagement Care Program. So you got behavioral health care professionals into that 911 emergency system, which is something that evidence has shown has really improved the outcome of those who are in crisis mode, and that system is just, continuing to grow and expand. I even know some community partners, Northwest Center, who are looking at building their own, and I'm just so excited to see this continue to grow. So thank you, everybody who's been working on the CARE program. Oh, one more, sorry. Okay, food access, food security. So we had the community co-led, favorite words, Food Equity Council, which passed the Urban Agriculture Ordinance. So healthy food, close to home, y'all. Let's give it up for that. People working on those. And we passed the Connected Communities Ordinance for equitable community development near transit, so you don't have to go all over just to get what you need. So those who are working to improve our neighborhoods, planning and development, thank you for those. And the public health system, which reminding everybody again, everybody's part of the public health ecosystem. Finalizing Chicago's equity decision support tool. So this is amazing because this will be a tool that not just communities, but government, other agencies can use to help guide how we approach programs, budgeting, policy making, system building by using this tool baked into the guiding principles. So you can just go through it and say, this is a great system, it's gonna help everybody, or oops, we messed up, we about to, be unintentional racist with our system. Okay, Healthy Chicago recommendations.
Okay, you're almost done, I promise. You've almost made it through, but we would not stop the presentation today, and we do not stop the work here today. We are here to really make commitments again to each other and to the city of Chicago about the things that we can do within our power, within our span of control, to close that racial life expectancy gap. So here are a few commitments that the Chicago Department of Public Health is going to be making, and then we call upon all of you to think about what commitments you are prepared to make today as well. So first, Healthy Chicago Equity Zones, where are you? Let me hear you. Our commitment to you all is that we want to continue to partner with you to build community power and capacity towards health and racial equity goals. You are 6 regions, 1 Chicago. Woo! And our commitment is that we will continue to nurture and to find ways to financially sustain your community-identified health priorities and projects. We are so excited today to be releasing our Healthy Chicago Equity Zones playbook that you all have helped to prepare and to draft and to birth into the world. This is the roadmap for steps that we can take with community partners to help to change some of the data that we talked about today. And that roadmap is so well aligned with the commitments that this city is already making through its racial equity action plans that departments have been putting together and the commitments that they are making publicly. So we see that there is so much strength and power in continuing to work together with our friends from the Office of Equity and Racial Justice. There you are. And that is our commitment to you. We are also committing to continue to promote health equity in all policies. Shout out to my HEAP team in the back. continuing to work with city departments to create these permanent structural changes so that equity is routinely considered as part of our decision making. As Jenny just mentioned, we are about ready to release this equity decision support tool that many of you in the room had a hand in helping to craft. If you were part of our advisory council or have done work with the HEAP team on that tool, you want to give a clap or a shout? Yeah. And then finally, we know that in this moment, it is more important than ever to continue to strengthen our public health workforce and our public health infrastructure. So in 2001, taking y'all in the Wayback Machine, CDPH had 1,861 budgeted positions. By 2019, before COVID, we had lost 68% of those positions, and we had reached a sort of low point in our own public health employed workforce of only 588 people. And of the 34 non-recurring federal grants that CDPH has received since 2020, which is really when we got this huge infusion of resources to respond to the COVID-19 pandemic, we know that 26 of these are going to be expiring between July of 2023 and January of 2025. So we are facing this tremendous fiscal cliff. It represents a $121 million annualized decrease in public health funding for the city of Chicago. So our commitment is that CDPH is going to continue to advocate for flexible use of the grant dollars that we do retain and have additional resources to invest in these proven and promising practices to close the life expectancy gap. And we ask for all of you to continue to join together and think about ways that you can support sustainable funding for this critical public health infrastructure in this city. All right. So who is the Healthy Chicago movement? You are the Healthy Chicago movement, and we celebrate you, and we thank you, and we cannot wait to continue this work with you through 2025 and through the Healthy Chicago movement to come. Thank you for being with us here today. So I'm going to ask now that you indulge me for just a moment as I go off script to say something entirely of my own accord. We've been talking a lot today about 2025 as a movement, right? It is more than one person. It is more than one organization. It is more than any one community. This is truly an endeavor that takes the collective effort of all of us and so many more in the city to close Chicago's racial life expectancy gap. But I would be remiss if I didn't acknowledge one person who has had a hand in all of the initiatives that I have spoken about today. She led us through COVID with incredible courage and grace and commitment to equity. She has continued to work tirelessly to garner resources for our department on these critical drivers of the life expectancy gap, helping us to get grants for substance use prevention and to secure more city resources to expand access to mental health services. She has been a clear-eyed champion for our health equity and all policies work around environmental justice and equitable transit-oriented development and so much more. So even as we look forward today with hope and with great optimism about the potential for this movement to continue with new leadership and with new partnerships that are going to help unlock so much additional potential, we also honor her legacy. So if you, like me, count her as a friend, if you have worked with her on any of these initiatives that are so critical to public health, or if you're just a fan of her Facebook Live, I invite you to join me in sharing your thanks to Dr. Allison Arwady for her 8 years of incredible service to the City of Chicago and to the Chicago Department of Public Health. Thank you.
Thank you, Megan, for your emotional message. Good morning. My name is Cynthia Ibarra. I'm an information coordinator at the Chicago Department of Public Health. I'm here because Dr. Geraldine Luna, Chief Medical Director for the Chicago Department of Public Health, couldn't be here, and she would love to deliver a message in Spanish because she's been part of the Healthy Chicago movement. So I'm just going to take maybe 2 to 3 minutes to speak in Spanish. Bear with me, and thank you so much for being here. Muy buenos días. Qué bueno y qué gusto poder estar el día de hoy aquí con ustedes. Me da mucho gusto poderles comunicar el mensaje que el día de hoy tenemos para ustedes de nuestro movimiento de Healthy Chicago. Es un honor y un privilegio poder estar aquí el día de hoy. Gracias, organizaciones, socios comunitarios, líderes de la comunidad, Departamento de la Salud Pública de Chicago, por poder hacer posible este movimiento, por poder seguir luchando para cerrar la brecha de la esperanza de vida. Especialmente para nosotros, la comunidad latina, una comunidad que de cierta manera es el corazón de la ciudad, que poco a poco ha ido creciendo, que nos tenemos que enfrentar a tantos desafíos, a tantas problemáticas. Ustedes sabrán cuáles son, yo sé muy bien cuál es. Sin embargo, aquí estamos para seguir luchando por el Chicago que merecemos en este evento tan especial y sobre todo para poderle dar frente a esa problemática. Muchas gracias de nueva cuenta, organizaciones, Departamento de Salud Pública de Chicago, líderes comunitarios y todos los que hacen posible formar este movimiento. Durante la presentación que muy amablemente ahorita Jenny y Megan comunicaron en su bellísima diapositiva, vimos que nosotros los latinos, pues bueno, sufrimos un poquito ante todas estas problemáticas y sobre todo que nuestra brecha de esperanza de vida desafortunadamente en los últimos años ha ido disminuyendo. Pero con programas como este, Healthy Chicago, podemos hacerle frente a esas problemáticas. Podemos hacerle frente y podemos brindar soluciones reales para que esa brecha de la esperanza de vida vaya disminuyendo cada vez más. A nombre de la doctora Geraldine Luna, a nombre del Departamento de Salud Pública de Chicago, nosotros como organizaciones, como el departamento que somos, debemos de seguir unidos, estar juntos y seguir haciéndole frente a la problemática para así poder disminuir esa esperanza de vida y cada vez más nosotros, los latinos, poder seguir aquí enfrentando lo que día a día tenemos que enfrentar y seguir haciendo esta gran ciudad una ciudad santuario que recibe a gente de todas partes del mundo y sobre todo que los latinos formamos gran parte de ella. Thank you so much for listening my message in Spanish. I hope I didn't bore you, but thank you so much. And John is next. Muchas gracias.